Hi everyone. You're going to see the title there. It's called The Double-Edged Sword of a Harm Reduction Movement in Mauritius. I actually use the same title I use in Durban because I thought it was really cool for such a shitty situation that I'm about to show you. But every time I've done this presentation, it brings the mood down. But hopefully things have changed a bit, and I'm hoping that by the end of it, I'm not going to be sad. When we think of Mauritius, mostly people, that's the first thing I Googled a couple of days ago, and that's the first picture that came up. Beautiful beaches, and it's actually a beach in the southeast, so obviously there's more tourists around, but this was taken at some point when no one was there. And a lot of people have that image in mind, obviously, because we don't know the backdrop of what's actually happening there and what we've been doing. But Mauritius as well is renowned for the fact that harm reduction actually works. It's been an example for Africa, especially because of we were the first country that introduced the harm reduction programs like the needle exchange and methadone program. As you can see from the graph, harm reduction actually works. It reduces HIV incidence among kids, and also it's an access point to a population that remains hidden. But Mauritius as well is this. I got this last night on Facebook actually, because that's a slogan competition that was done by Aberystwyth University, a Wales University-based campus in Mauritius. And as you can see, the perception on drug use and the sort of images and the information being sent out to young people is very, very negative. But Mauritius is also this, where you will see that Rastas peacefully protesting so that they can use cannabis as part of a culture get beaten up by police officers. This was taken last year, end of I think October or August, I can't remember the exact date. But there's one picture that actually stays in mind, and it's this one, where you can see there's a woman with a child next to her, and she's using an umbrella to block the baton of a police officer. And for me, this shows the extent to which the war on drugs is happening in different countries, and especially for Mauritius, especially for a drug like cannabis, which, after the presentation of Professor Nutt, you can see that it's not that harmful. But let's get back to some statistics on Mauritius. Currently, there's about 5,245 men and 1,677 women who have been infected with HIV. And based on our last mapping that was done in 2014, there's about 9,000 to 11,000 people who inject drugs in Mauritius. For a population of 1.3 million, that's quite a lot. And the other thing about that is that 97.5% roughly have hepatitis C, and about 44% of people who inject drugs are living with HIV. There's no study that actually has been done on any of the drugs in Mauritius, so we don't actually know the extent of what sort of drugs are being used. Pills did a survey, so we have a rough idea that about 15% to 25% of the population have actually smoked cannabis, but other drugs is still a bit vague. And the last bit, you will see that there's 4,144 patients on MST currently, and 54 joined since June 19th of 2017, and I'm going to explain why in a minute. To sort of the lessons that we need to learn from Mauritius is a bad one, basically, because end of 2014, that's the time I actually joined CUT, there was an election and the government changed. And the new government announced in its manifesto that it's going to resume the war on drugs. And the first order of the Minister of Health, he was in office for like a week, I think, and he announced that he's going to decentralize methadone substitution therapy outside the police stations. It was being done in health centers, but he thought that it has to be done outside the police stations. And as well as that, it was a pilot phase. The pilot lasted like 2 weeks. And in January 2015, all MST distribution is actually done outside the police stations from 6 a.m. to 8 a.m. only. This was done because the minister believed that after 8 a.m. school kids are going to be going to school, so we don't have to see this population. And I remember as well that we tried to speak to the police officers to try to get the caravan at the back of police stations in front, but they refused to acknowledge that fact because for them it didn't matter. This is a guy who actually brought in the change, and the reason why I put this up and I highlighted the red bit downstairs is because he said something. He basically said that methadone is a dangerous drug and that government is a drug trafficker. Now, that statement by someone who's a Minister of Health actually brought down pretty much 10 years of work that CUT and other partners have been doing in the field, basically, because he critically said that methadone doesn't work and it's a drug and we need to stop it, basically. And in June of 2015, he announced that methadone substitution therapy will be stopped. But civil society got together, we advocated and we used the press as allies to try to save the program. We were able to keep the 4,300 patients at the time who were on it. They were able to still get methadone, but he stopped the induction for new people. So new patients couldn't get access to methadone substitution therapy. And from July 2015 to January 2016, there was no substitution therapy being offered to new patients. There was nothing. Basically, in January 2017, the minister announced that there's going to be a miracle therapy of Suboxone and naltrexone, and basically the aim was to get people drug-free. And this year, 400 million rupees has already been allocated to repressive measures, but nothing has been mentioned on prevention, on treatment, and harm reduction. Let's get back to the Suboxone and naltrexone ring. Well, there's no actual protocol. We've tried to get hold of it, and we haven't been able to get it. Basically, people go on it for 2 weeks for Suboxone, and then they're followed by 6 months of naltrexone, along with brief psychotherapy. Since January 2016, there's been 375 people who joined the program. I got these figures from someone from ministry. And when I questioned the person about the rate of success, he couldn't give me any straight answer because we don't have a straight answer. And the statistics they're trying to use to prove that this is actually working, is getting people drug-free, is biased. And he knows that if we get the real figures, we will be able to question them and we will be able to challenge them. What's happened to NSP in the meantime, Neil Singh's program, is that there's been a steady rise of people coming to the sites of CUT where we do needle exchange, because obviously there's been a lot of controversy on the quality of methadone being given to people, because patients who've taken it in the morning have to actually inject again in the afternoon. There's no confidentiality, as you can understand, going outside of police stations to take your medicine. The hours are not friendly. You have to get up at 5 in the morning to go get your dose at 6. And if you miss the 6 to 8 a.m. slot, you won't get methadone for the day, so you will have to go and inject. So CUT saw a steady increase of people coming to our sites. We used to, on average, reach about 2,000 people in 2014. And post-2015 and 2016, it's gone up by about 300%. So we're reaching about 3,500 to 3,600 people, 700 people per year now. But the main thing that happened as well is with a change in government, the minister, advised by the doctors present, they put a cap on the number of needles we can give to people. If you, on average, we're reaching about 1,500 people per month, and to actually be able to give them the right materials, we need about 100,000 syringes. But now we're only getting 30,000 syringes, so we have had to impose a quota on people by giving them only 3 syringes for a week. You can imagine that that's not working. And the end bit, you will see that this is an ongoing fight because the government has demanded that we give national identity cards of our beneficiaries. We've been using what we call UIC, the Unique Identifier Code, which was sort of implemented by the Global Fund. But they don't want that. I remember in a meeting I was sat with, there was a minister, there was a doctor, the director of health services, who's a psychiatrist. And when I was saying that we can't provide national identity cards of people who inject drugs, she looked at me and said, look, diabetes patients gave us the ID cards. She doesn't understand why people who inject drugs can't give ID cards. And I was sat there trying to think of a response and trying to get rid of my anger as well, because that was a psychiatrist, someone who's in charge of the director of health services, comparing diabetes patients to people who are heavily criminalized. And yesterday was a meeting with the government again, and they gave CUT a month to give all the details. And if not, they potentially will be removing our right to actually do needle and syringe programs and distributing syringes. Now, the result of the bad policies is that, as you can see, HIV incidents among people who inject drugs went up. And that's just, these figures actually don't really reflect the reality as well, because the number of tests being done with care-affected populations is far, far below the number that actually needs to be done. And now I'll normally sort of end with this slide, which is sort of a bummer, but I'm going to tell you a bit about the policy work we've been doing, and which has actually been a bit more positive. That's the Director of Public Prosecutions. He released a newsletter in August where he was heavily criticizing marijuana, saying that for him, we can't actually engage in a debate on decriminalization. But I met him with a few other people, and I presented him a paper which I wrote on why we need to decriminalize, and he actually looked at the evidence, and he actually changed his point of view. He actually said it in a newsletter that he released in September, and he said that he now understands that there's evidence out there that we need to have a paradigm shift. We need to actually engage in a dialogue to change what's been happening. And Natalie sort of talked about that yesterday, but what we've been doing as well is we've been trying to engage with high policy level makers, and Support Don't Punish has been a huge, huge help with that, because I've used it as a means to get people together. It's really hard to actually have a meeting with government officials and having people who use drugs there as well, because they don't acknowledge people who use drugs. And in every meeting when I've been, I've actually said that we can't have any programs developed if you're not being inclusive of people who are concerned about these programs. And I've had like shouting matches with law enforcement during the last National Drug Control Master Plan development, because they didn't want even to have human rights being included on the title of a National Drug Control Master Plan. So what I did for the Drugs Over Lunch thing in 2016 Support Don't Punish campaign is I invited MPs and ensured that at every table, there was about 9 tables, I think, there was someone who used drugs on that table, so we can have a direct conversation with members of parliament. And we sort of planted a seed, because Natalie mentioned that yesterday. Since 1999, no political party in Mauritius engaged in any discussion and debate whatsoever on drugs. And the reason is because in 1999, Kaya, a famous Mauritian singer who invented what we call Sega music, he mixed Sega and reggae, he died in a police cell because he was arrested for having smoked marijuana in public, and then he mysteriously died in police cell. No one actually knows what happened. There was a commission, but there wasn't no investigation that was done afterwards. So, and after that, there was a riot. So people had, we had people who died, like 3 people died during a riot because people started manifesting and causing, really just showing the people in power that there's a problem here. So since then, people have been very reluctant, especially politicians have been very reluctant in actually engaging the public in a debate. But this year, after like 20 years or something, one political party invited Natalie and I to talk about why we need to decriminalize cannabis. And it was an opportunity for us to actually present other things that has been done around the world. And I used that opportunity to talk about Portugal and what's happened there, and what we can actually, how we can implement the same procedures, the same policies in Mauritius. And Natalie mentioned it as well, that through the Support Don't Punish campaign this year, we managed to have a workshop with about 49 religious leaders, and where we talked about drug policies, we talked about harm reduction, and how we need to sort of change our policies who are heavily criminalizing people who use drugs. Now, I can tell you that being in a room with about 49 religious leaders, what I did first, I sort of listened to them, because I wanted to give them a space to talk, and most of them started talking about religion and how we need to save people and how we need to save people who use drugs, and that drugs are evil. And then I went on stage and I talked about the origins of a war on drugs. And this is one of the slides I used, because I told them that I understand your point of view, but what you know about the drug policies, what you know about the drug war is actually a lie. So I started off by describing drug policies, and I used this as an example, Harry Enslinger and what he said about marijuana users at the time. And I challenged their perception, and challenged their thinking process, and I'm happy to say that it actually worked, because now there's a technical working group with the Council of Religions. We're actually working on a document to submit to the Prime Minister to ask for a change in laws in Mauritius. I don't know if it's going to be successful or not, but having the backing of religious leaders is extremely important, especially in a country that values religion so highly. The other positive thing that's been happening is that people who use drugs have been mobilizing through the Canker grant, through the regional grant, the Global Fund. We are setting up a drug user network in Mauritius. It's taking time, but because a lot of people there have actually got problematic drug use, and a lot of them have other issues in mind. They need to get food on the table, they need to get money to be able to get their dose, so asking them to work with us to try to advocate, it takes time because not all of them will do it. So we're slowly building it, and hopefully we've got a coordinator for the network, so hopefully things are going to be more formalized in the next few months. And I'm nearly done. But one other thing that happened as well, in the Hansard, which is the paper written for the debates that happens in Parliament, this year in June, just before the reintroduction of methadone, so methadone is now actually being re-given to people, a minister stood up and said, moreover, methadone substitution therapy is a proven evidence-based therapy for treatment of drug addicts. Well, I don't agree with drug addicts term, but at least they actually acknowledged the fact that they were wrong, and that methadone is not just a drug being given to people, but it's a medication being given to people who actually need it. And coming back to the Rastas at the start of presentation, they were arrested, but the charges against them was dropped. And that happened a couple of months ago, so they will not be prosecuted for the peaceful demonstration that resulted in police actually beating them up. I'm going to end here, so if you need more information, you can find it on CUT's website, and we're on Facebook, and as well we've got a Support Not Punish page as well, where you can follow what we've been doing. Thank you.